Hi, viewers. This is Susan Mwita, your health advisor with True Living Show, which comes via Sky Cable TV. We are just continuing with type 2 diabetes. And today we are going to talk about eyesight, or we are going to talk about the eye, how to deal with the eye. The reason is that the other series we started with type 2 diabetes. On the first series, we just covered in general of what is diabetes. Then after that, we came to the second episode, that was diet. And then after that, we were able to cover the skin. Then after that, then we covered diabetic foot care, because all that is all concerned with how you take care of yourself, how the diabetes affect each part of your body. And today we will cover about the eyesight, how you take care of your eyes, how you are checked your eyes, how you know you have diabetes. Because in the past, or when we listen to other people, there are people who start getting eye problems, and then when they go to see their doctor, they are sent to a specialist who checks the eyes, and that the doctor who sometimes states that maybe that patient is diabetic. So some people can start having problems of their eyes, and they do not know that they are diabetic or they are type 2 diabetic. Because as we had previously said on the episode 1, type 1 diabetes, they know when they are very young or they are born with it. So those ones, most of the time they know. And then other people is when they have gestational diabetes. And then, but for our topic and continuous talking, we are talking about type 2 diabetes. So let's start there. So the eye is a vital organ of our body, because we need it, because that's what we use to see. That's what you see, the color, you see whatever is near you, you see far, you see near. So we have to really take good care of it. And when diabetes is not well controlled, your eyes get messed up early, and you become affected, and so you have a lot of problems when you are diabetic. And then you have let's say like retinopathy of the eyes. And we should talk about the eye visions. When do you have normal vision for your eyes? We know when we go to our eye doctors, or when we hear from people who knows about the eyes, the normal eye vision for a normal person is 20/20. Then when we move from there, then we can say 20 to 100. That's some people, they have that. You can still see, but you can see clearly for like 100 feet. Then when you get to 20/200, then you will start having vision loss. You're heading to the other side of becoming blind. And that's why I want us to discuss. And those are not the only numbers. There is even 20/30 on the lower side. There is even 20/300. There, I think you're already blind, or you cannot see, or when you see things, they are very blurry, so you cannot tell. So let's start here. So what usually happens? May I ask you a question? How does the type 2 diabetes affect your eyes? Type 2 diabetes affect your eyes because sometimes, like if we go to a demonstration here, the sugar becomes too high, because when your sugars go high, sometimes, when it's taken to your when the blood is taken, let's even give an example with Miss True Living. When the blood is pumped on her heart, you know, and it goes to other places, and let's say the sugar is high, that means, you know, that sugar goes to her eyes, you know, because it's going to the whole body. And that high sugar, when it affects her eyes, it comes and affects her lenses. It also affects her retina. And that's why we understand that when that sugar is too high and you are diabetic for some time, your eyes get messed up. And that's how, when there is too much pressure, especially when the sugar is high on your blood, because already when you are diabetic, you don't have enough hormone to convert that sugar and take it to the cell. So the sugar is left on the bloodstream running. So it will go all over your body, all over wherever it is with high sugar. And it gives the lenses issues. It also gives the retina some issues. That's how you end up getting retinopathy. I know there are other problems which, you know, which causes, you know, retinopathy, but high blood sugar is one of them. And also the lenses, you start seeing blurry. You don't see very well. So that's how you end up getting messed up, because this is the whole eye with all, you know, different areas. You see, like here we have like where the nerves are, and sometimes they are affected. And the most common, you know, types of problems when you are diabetic, you start getting, especially if your diabetes is very bad, and most of the time, if you have lived with diabetes for some time, you get the cataracts. You know, the cataracts, you start getting cloudy vision. And at the end, when it's become so bad, you become bright, you know. Then you get glaucoma. Glaucoma is like gray. You can't see well, you know, you have glaucoma. So, and on the glaucoma, the nerves, they are usually affected on that. Then, as I had told you about the retinopathy, it's the retina which is mostly affected. And then, you know, at the end, after you get retinopathy, then you proceed, it gets worse. Then we say you have vision loss. You can't see well. And then the end of it is blindness. You can't see totally. There are people, we say they are legally blind, according to, you know, when the doctor judges it. And also there are those people who are totally blind. They can't see. So that's how diabetes can mess you up. So let's say like Miss True Living has all those issues. So how would we rectify all those issues? So the best thing to do is, you know, should go to the specialist for the eyes. And how we should start. We should not even start with the doctors. Yourself, I'm sure most people, they don't know when to see the doctor. But when you're diabetic from the beginning, you should see the doctor, and your doctor should send you to your primary care doctor, or your PCP should send you to an endocrinologist, the doctor of the diabetes. And then you should have another referral to see ophthalmologist for the eyes, or the optician, you know. So you should, once you are diabetic, you have a line of many specialists, starting even from your nutritionist, starting from your primary care doctor, even for your cardiac doctor. So it's like, because it's a disease which affects the whole body, so you should have all the specialists, if it's possible, for all your systems. Even a psych doctor you should have, because sometimes when you're dealing with this disease, you feel depressed because it's like you're told you can, you're not, you're told, but the way it is, you can eat this, you can do this, you have to take care of your feet, you have to take care of your skin. So sometimes people end up being depressed. So but that's a topic for another day. So let's get back to where we should be. So let's say she sees a difference of her eyes, and mostly even normal people who are not diabetic, when you hit 40 years to 50, you start having eye problems. There are already people who are born with different types of eye problems, strabismus. There are those who are short-sighted. There are those who are far-sighted. There is the normal person who has no issue. I think it's called emetropia. Then there is also presbyopia. That's the one I was talking about, 50 to 40 to 50 years old, because most of that age is when you start seeing people with reading glasses, because they can't see well. And so it goes like that. Realizing that she has issues with her eyes, she'll go to the doctor, and maybe the doctor will prescribe reading glasses. Like here we have the reading glasses, depending on the acuity of whatever the doctor will decide on. Depending on all the tests should be done. And then there'll be, glasses for short-sighted or far-sighted, depending on each. And, she can wear whatever glasses which would fit her. But normally what I would say, if you are diabetic, the best thing is to take care of your eyes. Always have an annual exam. Always, if there is a change of your eyes, do something. The other thing is, when you are diabetic, try to clean your face all the time well, with warm water. Remember, when you are diabetic, you use warm water, or water which is in between. It's not cold, it's not hot, just because of your nerves. So you wash your face, because here where the eyes are, we are talking about the face. So wash it nicely with a soft cloth. I would recommend a bright color cloth. Here we have white, we have yellow, we have light green, we have light blue. So that way you'll be able to clean your face well, and you can check on it. Another thing I would talk about, try to exercise the muscles of your eyes. You can do massage. You can be doing massage around the eyes. That is to strengthen the muscles, because even to see well, you have to have good exercises. You can even massage on the side most of the time. Even when you are seated, you don't have to go anywhere to be done those. You can just be doing exercises. Even normal people, you are supposed to do exercises with all part of your body. And especially now we are talking about the eyes. You can be massaging. You can be massaging here, massaging there. And the reason for that massaging is you are helping the blood to circulate. You are warming your face, which is very healthy. Another thing is when you go out when you're diabetic, it's good to always to wear sunglasses, especially when the glare is too much or too bright. It's very good because that helps you prevent, that right ray coming to you direct. So sunglasses are good, especially even when you go to the beach. When you walk on the sun, you prevent a lot for yourself. Let's say you don't have enough sleep, it's during the day and you want to rest, or wherever you sleep there is not enough darkness, because darkness is good for your eyes to rest. So you can wear the mask for the eyes. You can wear the mask so that you can sleep deep. And sleep is good for diabetic person, for everybody, so that you can have good circulation. And there are different ways of taking care of your face. When you wash your face, try not to wash it just like that. Just try to pad on your on your face, and then you can wipe it nicely, and then you can apply the face cream. You can also check on your eyebrows. You take good care of them. And another thing is, you can always be checking your eyes, so that inside, so that you can know whether you have cataract or you have glaucoma, even when you're at home, because somebody might see a difference on your eyes, because when this disease progresses, that's when everything starts getting worse. And when the sugar becomes too high, you get messed up. Or if you have lived with this type 2 diabetes for long, then you start getting changes of your eyes. You can't see well, and one day you might wake up, and because your nerves are messed up, your retina is messed up, your iris is messed up, all these other part of the eyes, the sclera, the pupil, they are all messed up because of the disease process of the type 2 diabetes. So you have to keep on checking yourself, and you have to be following the rules the way you are told. Another thing which I would like or recommend to people, sometimes people get like they have the dry eyes. The doctor, or you can go to the pharmacy or the chemist, you can have eyes to relieve, because when you're diabetic, either you tear a lot or you dry so much. So this one is dry eye relief. You can use it. You can follow the instructions, each like 1 drop twice a day, depending on the instructions or what your doctor has told you. Then there is another one for allergy. Where is it? There is one for allergy. It relieves allergy. So sometimes when there is a lot of pollen, you can use it for that purpose. And they are well stored. They are like that, and they have good openings. So you can just open and put eye drop. And many people, they don't know how to use the eye drops. So like when you are told, because when you are diabetic and you have all these other problems that I just explained to you, so you go and the doctor can give you different types of eye drops to treat whatever disease it is. Sometimes even people get infections on their eyes and they get the eye drops. So there is a way you are supposed to put the eye drops. You're supposed sometimes to go up and then open the eyelid and pour it. But some people, they just go and touch the skin there, and maybe like if you have an infection, by the time you move to the other eye, you already have passed that infection to the other. So that's why you find like when some people have infection on one eye, the other one ends up getting infected because they don't use the eye drops the way they are supposed to use. And when you get eye infection, when you get eye infection, it's very bad, because when your body get any kind of an infection, your readings for your sugar goes up. So it's good to follow the instructions as they are, and that way you'll be able to deal with the diabetes. You are able to care for your eyes for better. And there are other things like a container to store your glasses, and you can even have pockets to be carrying on your glasses. And there are also like these microfiber lenses wipes you can use. You can use to wipe your glasses when you have your glasses, to make them clean, and then you can put them back on their pockets. And I hope you have come to know how to take care of your eyes well when you're diabetic. And you can use something like this when you're tired and they are red. This is bought over the counter, so you can use it. And another advisable thing I want to tell you, or to tell those people who are diabetic, especially who they have started losing their eyes, and and maybe they like reading or they like looking at something, you can have the magnifying glasses, because when you come like here, you can't see this because your eyes are already messed up. So you can come here and see like pupil. I can see pupil there, but maybe when you're far you cannot see. And I hope you have come to understand about the diabetic care of your eyes, how to prevent yourself from getting it, or how to know you have changes for your eyes, and to take care of yourself well, so that you can have more sight in the future. Just do the best you can. And this is Susan Muita, and with True Living Show, which comes through via Sky Cable TV. Do not forget to subscribe, press the like button. And if you have any comment or any question, don't hesitate, just ask us. Our show comes every Tuesdays at 8 p.m. Eastern African time and 8 p.m. Eastern time. And thank you. Bye.